Hi, my name is Araceli Correa, and I am a clinic registered nurse at Health Partnership Clinic. And today I will be discussing medication adherence within our patients and why it is a major concern in healthcare providers. Medication compliance is very important because it allows for providers to make the best informed decisions for patients when it comes to assessing whether a medication is being therapeutic, is it doing what it's supposed to do. It helps them decide whether they should increase a medication dose, stop the dose, recommend a different treatment. And so in turn, that allows for patients to have better outcomes, prevents further disease progression, or it allows for patients to expect a longer life. And it also helps prevent more frequent doctor's visits, trips to the ER, or admissions into the hospital. And so, as we know, healthcare costs are high today, and it lowers healthcare costs for patients. And so, for those reasons, it is very important. As a nurse, I would say that there are several barriers in medication adherence. I think some of the main ones would be cost. Medication costs can be very expensive, and so that is a barrier that a lot of patients come across. Patient education is also a major barrier because sometimes we don't understand what medications we're taking for what reasons. There are concerns to those medications, and so that is also a barrier that I've come across with our patients. And another common barrier is just forgetfulness. Sometimes we just forget to take our medications, and so it's unintentional, but that also is a barrier as far as why patients are not taking medications. As far as cost goes, as we know, again, medications can be very expensive. And so as long as the provider knows that this is a barrier, this is an obstacle that you've come across, they can look for different alternatives for medications. There are also programs that we use at Health Partnership Clinic, like the 340B program, which allows us to work with certain pharmacies, and certain medications are able to be provided at a reduced or less cost. We also have patient assistance programs where we work with pharmaceutical companies, and if a patient qualifies, then those companies will provide those medications for the patients as well. Also, GoodRx is a great resource to use. We provide cards where you just take your card to your pharmacist, and that also provides either a discount or a reduced rate for certain medications. So there are options as long as we know that cost is an obstacle. As far as patient education goes, I think as healthcare providers or healthcare professionals, we can provide the education that patients need when they have concerns as far as side effects go. We can provide education as far as why are they taking this medication, what is it for, what the dosing is, how long are they taking it. Is this something I take for a short period of time? Is this something I take for a longer period of time? What are the consequences of not taking my medications? And so all of this is information that we are also responsible for providing, and whether it's taking the time to sit down and discuss it, providing a form or document that gives them that information, this also helps patients trust in the treatment that they're providing and have a sense of control in their health. And so that also helps with medication adherence. And lastly, as far as forgetfulness, I know it's something that seems to be an easy fix, but it's something that is just very common. And so we always have recommendations as far as setting reminders on our phones. We all have smartphones these days, so setting a reminder. There are applications that you can download that will help you remember to take your pills. There are also tips like placing your pills at your bathroom sink or kitchen sink, and so when you're doing your daily routine in the morning, can remember to take your medications. There are also pill organizers or pill boxes where you can set your week up and put your pills in for every day of the week, and so then you know I've already taken my medication or I haven't yet, and this helps you kind of keep in stay on track as far as taking your pills daily. And so there are small things like that that you can do to be more adherent to your medication recommendations. And so it is important to remember to read our medication labels, read the documents that come from the pharmacy when you receive your medication, where they provide recommendations and they provide advisories of, the medication might have a side effect of dizziness or drowsiness, or recommendations of not operating heavy machinery or driving a vehicle when taking these medications. And so it is also very important for us to read our labels, read our dosages, read how frequently we're supposed to take our medications. Are we supposed to take it with food or on an empty stomach? What time of day should they be taken? And so those are also very strong considerations in being able to be adherent of our medications. So in conclusion, medication adherence is extremely important for our patients. It improves quality of life, it improves life expectancy, and in all, it's in patients' best benefit. If you are interested in learning more about Health Partnership Clinic, you can visit us at hpcks.org.